the First Minister's facing growing demands to relax Scotland's 10-day coronavirus self-isolation rule. Nicola Sturgeon's due to update MSPs on the latest developments when Holyrood's recalled for a second virtual sitting this afternoon. Let's speak to the Scottish Conservatives health spokesperson, Dr Sandesh Gulhane. Good morning to you.
Good morning, Gary.
Given the record number of cases that we've seen in recent days, do you believe we can ride out this wave?
I think what we need to be clear about is Scotland has the absolute strictest rules anywhere in the UK. We're out of step with the rest of the UK. And what we need is we have the need for caution. But Nicola Sturgeon's dithering and delaying is simply continuing to have a massive impact, not only on frontline services, but on ScotRail, who are cancelling trains and their timetables, on ferries. We can hear that islanders are struggling to just have normal life. And it's really disruptive for everyone. And care in the community is suffering. And it's really something that we need to get ourselves back into step with.
But isn't the reality when it comes to most of the restrictions, but isn't the reality when it comes to most of the restrictions that actually England is out of step with the other nations?
Well, this change from 10 days of isolation to 7 days with if you're asymptomatic and you have tested negative twice, and also household contacts if they're negative PCR, is having a massive impact upon our lives, our businesses, the way that people are going to work. I know of people who have had 3 weeks of self-isolation because people keep testing positive in their household and they're just simply unable to get out and go back to work. And that is something that's really difficult for people to live with. And it's really disruptive on people who are sole traders, who are individual people who are trying to run a small business and are just simply unable to. It's not something that we can sustain. So
reducing the time limit from 10 days to 7 could see more people actually spreading the virus. The Royal College of Nursing, whose members are having to deal with the impact of the staff shortages, are against this move to 7 days in isolation. It is arguable that a change in the regime could backfire, isn't it, in terms of the number of cases that we see because of people who are positive spreading it?
What we need to be clear is it's people who no longer have symptoms and it's people who are testing negative. So we're not going to be seeing that increasing numbers. But this is an interesting conversation to have right now, is about information and data. And I don't understand why the Scottish Government is so secretive with the information that it's using to make decisions upon. That information should be made available to the public. It should be made available to MSPs, at the very least, for us to be able to see the reasoning and the decision-making process that is going on in Scottish Government. Because right now, it's not transparent. We had John Swinney come onto I think it was your programme, and quote figures that were wrong. But the fact is, this is all to do with the information that we need to have available. And I simply don't understand why there's no transparency in that. When it suited the Scottish Government, they published a paper to say Omicron is really dangerous and it has big potential. And so we all read that paper and thought, OK, we understand this. But why has that not continued?
Well, some of those figures that John Swinney talked about are being updated today. So we are, or at least this week. So we are due to get an update there. Can I just check with you, as schools are returning this week, is your party still against pupils wearing face coverings in school?
Well, sorry, just to go back onto the John Swinney.
I want to move on to this because Mr. Swinney has said that the figures will be updated this week.
Not only, yes, the figures will be updated, but what he quoted were figures to support an argument. So he's quoted figures from the 23rd, and the restrictions started on the 27th. And so he was quoting things which were completely wrong. But just to go on to onto education.
Face masks, specifically face masks, because in August of last year, your leader, Douglas Ross, said he was particularly worried about young people wearing masks when they returned to school, which they weren't in England at that stage. Oliver Mundell said something along the same lines in July. Yet now England are wearing face coverings, so pupils in England are wearing face coverings. Do you support that measure now in Scotland?
We know that face masks cause a lot of disruption, and it causes a lot of disruption to people who have needs, people who have difficulty with their hearing. We know that face masks, we've been told.
But I'm talking specifically about the spread in schools. Given that schools are returning, do you support the wearing of face masks for pupils in schools?
So what we need to be is flexible. on this issue. We need to be flexible to see. So Christine Tate-Burkhart has told us that we know that when the schools go back, we're going to see an increasing in numbers. And so we need to be in a position where it's not just one rule, we stick to it and that's what we do forever. We need to have some flexibility to say, well, actually...
But how does flexibility work when it comes to face masks in schools?
Well, so this is the way the flexibility works. We need to be flexible to be able to say that there are scenarios and times where we need to wear face masks in schools, but if we can remove them as quickly as possible to allow pupils to go back into normal learning, to allow pupils to actually have the learning they need and not be disrupted, then that's what we need to do. When we were calling for that, that was the right time for us to not be wearing face masks. That was absolutely the right time. But when it comes now to the Omicron variant where we know we're going to see a massive increase, then this might be a scenario where we have face masks in place to give us some protection. But the point is, it's all about the information that the Scottish Government seems to be keeping a secret, and I simply do not understand why that is the case.
Thank you very much for speaking to us this morning, Dr Sandesh Gulhane, who is the Scottish Conservatives' health spokesperson.